So first of all, hello everyone, and thank you very much for joining me on your lunch hour for the rescheduled session for Reimagining Health Policy in a post-COVID world. This is the final installment of this year's PRCA Health Group annual conference. We really want to make this as interesting and engaging for you as possible, so please do get involved and put your questions to our panelists in the chat throughout the session. And if you are posting on social media, then please make sure that you're using our PRCA Health Conf hashtag. Today we're looking at the impact of the pandemic through a policy lens. It's fair to say that over the last 18 months, healthcare organisations have been thrown into overdrive, collaborating with policymakers to support healthcare systems with unprecedented level of demand and accelerating the development of vaccines and treatments to bring the pandemic under control. So as we now look to getting health back on track, what should the priorities be? What are the challenges? And how can organisations take action to support healthcare systems for the future? To answer these questions, I've got a wonderful lineup here of speakers who work across policy and public affairs. So please welcome Katie Saxon, Senior Partner at Portland Communications, specialising in health policy, advocacy and campaigns. We have Declan Mullaney, who's Public Affairs Manager at Livy, a leading telemedicine provider that specialises in online GP appointments and who many of us will become acquainted with probably over the pandemic as we couldn't go to see our GP in person. And Joe Taylor, Director of EMEA Policy and Government Affairs at Securus, one of the world's largest influenza vaccine companies. Joe was also a member of the UK Vaccines Task Force. So to kick us all off, I think we'll just jump in right at the start. Katie, where were the big health policy issues before COVID-19, before the start? And do you feel that these are getting back on track?
Thanks, Matt. Big question to open with. Because of course the healthcare agenda was packed before COVID, and so there's quite a lot to pick up on. Now that things are starting, we hope to settle, but I think we all accept that we now live in a world where we have to live with COVID, and so that isn't going to go away anytime soon. And of course, the obvious answer is the backlog that we've read so much about and everyone will be exceptionally familiar with remains, I would say, at the top of the Secretary of State's list of priorities at the moment. But of course, there's many other things he needs to start to turn his attention to. I think it's linked, though. The first I would highlight is the sustainability of healthcare systems. It's long been on the agenda. I think it's firmly something that needs to be explored further. I think it will be really interesting to see the extent to which this is discussed around COP26, because of course we are well versed in talking about environmental sustainability, but I think increasingly we need to be talking about healthcare system sustainability. And there are lots of players out there, many who have been active through the pandemic, for example, AstraZeneca, who are exceptionally interested in talking about healthcare system sustainability and how the private sector can support systems to withstand these types of global pressures. I think the second thing I would probably touch on is integration. In the 10 years I've been talking about healthcare policy, I must have said integrate. If I had £1 for every time I said integration, I would not be here with you all this afternoon. I'd be on a beach somewhere. But it's an incredibly difficult, complicated agenda, but one that I think the government and Boris Johnson in particular, the Prime Minister, has attempted to address with a very big and bold spending commitment towards social care funding. But that's not a policy programme. And it doesn't resolve the kind of structural integration that needs to happen. Many of you will be aware that obviously the Health and Social Care Bill is currently working its way through the House at the moment, which goes some way to driving that integration. But so much of that is more behavioural and attitudinal and cultural within the NHS. So I think that continues to be a major priority. And the final thing I would flag that I think needs to get back on track and is in some way helped by the conversations that have been had around the vaccine and the pandemic is the adoption of innovation in the NHS. And the life sciences vision certainly goes some way to staking, drawing a line and the government to establish its position and its ambition. We've seen ambitious statements like this before, and I think it will now be the extent to which government in the UK can drive change and start to implement some of this ambition. Speaking to a company this morning, a Singaporean biotech, looking to bring a new innovation to the UK. There are no guarantees, it's not straightforward. And I think the life sciences vision goes some way in stating that ambition, but it by no means has all of the answers. And of course, we've seen big players fall out of Europe. For example, Bluebird Bio exiting Europe is a really clear signal to payers in Europe and indeed in the UK that we are not yet seen to be a home for innovation. And so I think that is something that will need to be addressed pretty rapidly.
So that's a really interesting point actually around the Bluebird Bio situation and in particular the UK's position as a life science destination. And on that point about resilience as well, Joe, I was wondering if I can come to you on this. I mean, the pandemic has left a significant financial burden on healthcare systems. How do you feel that's going to affect the government's priorities and policy making, particularly if they've got to balance resilience and building back up the NHS, while also at the same time advocating that position for the UK being a premier life science destination?
Yeah, good afternoon, everyone. Thanks, Matt, for the question. It's a pleasure to be able to talk to you today at the PRCA conference. So the first point to make on that, Matt, is that the pandemic hasn't just left a significant financial burden on healthcare systems, but it's placed, I think, a severe strain overall on the NHS and health systems, and will do probably for a very long time. The health service is emerging from the greatest health threat of our lifetime. It's under pressure, not just financially, but it's exhausted, it's under-resourced, and with no sign of respite, given, we hear about all the enormous waiting lists that they now have to tackle. But another important observation is that this is the case, obviously, not just for us in the UK, but for health systems around the world. I was at a meeting recently with the European Commission, and they said that their number one priority was to help prevent EU member state health systems from failing as we try to recover from the pandemic, which is pretty sobering. And in order to manage this backlog and make sure that, as you talk about, Matt, the future resilience in healthcare of all health systems, the life science sector will have an important role to play in delivering both the goals of the NHS, but also helping to retain a thriving sector, which is imperative. Katie mentioned the Office for Life Sciences recently launched the Life Science Vision, and that gives us a framework for how the sector can support the NHS to meet the next challenges in a whole host of diseases and therapeutic areas, which includes cancer, cardiovascular disease, and the area that I work in, which is vaccine development. It also looks to build on the UK's existing assets that we have in academia, in genomics, and also in clinical research, and hopes to attract future investment in the sector. Again, recently I had a meeting with the newly formed Pandemic Institute at Liverpool University, and interestingly, Liverpool is identified in that vision as a potential future global centre of excellence for infectious diseases. It's also where we at Seqirus happen to have our vaccine manufacturing site, not at the university, but in Liverpool. So a thriving life science sector is critical if we are to help the NHS and to help meet future health challenges. And the UK must ensure it creates those conditions to attract investment. So through things like access to finance, we need a skilled workforce, we need robust regulatory frameworks, manufacturing capabilities, and also obviously opportunities for global trade. We need all of those, so we have to do both.
Thanks, Jo. And actually, if I stick with you for a second, actually, I mean, what we've seen actually through the pandemic is how effective the NHS has actually succeeded in mass vaccination programs. I mean, what do you feel the lessons learned here are, and how do we use these to manage future pandemics or even flu seasons?
So communication, good communication, was critical in encouraging people to take the COVID vaccine. And it wasn't just about the message, but it was about hearing that from a trusted advocate. That's what we found was the key to success. And you talked about the fact that I worked last year with Sarah on the vaccines task force. And one of my jobs was to help promote the clinical trials registry. And what that was for was encouraging people to sign up to be contacted about COVID vaccine research. And in the context of that work, one of the most effective campaigns that I witnessed was the work of a brilliant respiratory physician up in Bradford, Dr. Dinesh Saralaya, who enlisted the help of imams in the local mosques to talk about the importance of vaccination. The messenger is as important as the message. It's what we all know, but it's easy to forget it in a crisis. And what that meant was that those that were most at risk, say members of the BAME community, were effectively targeted and understood the increased consequences of contracting COVID. So if we could learn those lessons and apply those to flu, which is where I work, and I think that should happen both before and during every flu season to make sure that people understand the consequences of getting flu, for example, in the same way, then it would be hugely beneficial. In a bad season, flu can kill up to 30,000 people. So that's not dissimilar to COVID. COVID-19 was perceived by the public as a shared problem, in that everybody needed to protect themselves, to help each other and minimize the risk of passing on the virus to others. Wearing masks and washing hands, social distancing, reduced transmission of the flu virus last year. So all of those lessons that we learned through the mass vaccination campaigns and the social distancing measures would be hugely advantageous if you could carry those on in some way.
Okay. And with that, I mean, do you feel that there's other areas that essentially that companies like either in life science or healthcare providers should be playing an increased role now in terms of looking at these campaigns?
In mass vaccination campaigns, do you mean?
In public health campaigns in general.
Oh yeah, absolutely. I mean, we did some research or sponsored some research around Europe, looking at public perceptions of vaccination in the wake of COVID, and perhaps unsurprisingly, people are a lot more willing and see the value of getting vaccinated as a result of that. So if we could lock in some of that learning, that we, has obviously been the vaccination rollout has been, a success by anyone's standards, and apply that in future by, enlisting the help of health professionals. I mean, a letter, for example, from your GP telling you to go and get the flu vaccine was deemed the most effective form of communication and one that people would most likely listen to. Then we can make a huge difference, I think.
Excellent. Thank you. And Declan, to you, I mean, obviously as someone who works for an online GP provider, I mean, I think over the last 18 months, we've all sort of either had to use them ourselves or at least become more aware of them. Now, how would you say the system has coped with this shift to online GP appointments, given that I think it was 80% were in person before the pandemic?
Absolutely. Thanks, Matt. And hi, everyone. Great to join the panel. So yeah, I think it has been quite remarkable actually how resilient the system was and how quickly it mobilized to remote consulting, given that historically it's been quite resistant to change. So we moved from sort of 80% in-person appointments to, sort of 98% remote appointments at the height of the pandemic. So a huge shift. Arguably, though, the sort of mobilizing quickly in response to the pandemic was the easier bit. I think what we're seeing now is this sort of, which both Katie and Joe touched on, this sort of huge rebound in patient demand that was sort of pent up. That's not just in elective care, which gets covered quite broadly, but we're seeing it in primary care, which is spilling over into emergency care. And so I think the harder piece is how do we kind of bottle the gains of remote access that we've had during the pandemic, while also ensuring that people who want or need physical services can have those. So kind of what we describe as a sort of digi-physical service, rather than this binary choice that we've had a debate on before, which is around remote versus physical. So I really don't think we'll see a reversal of the trend to more remote consulting. I think it's quite notable if you look at some of the voices, for example, Martin Marshall, the chair of the RCGP, who's been one of the more vocal skeptics of remote consulting, shall we say, sort of coming out and saying that moving forward, he thinks there'll be a sort of 50% physical, 50% remote split between physical and digital. So I think digital definitely here to stay. And primarily because patient expectations and clinical expectations of how they interact with the healthcare system has evolved quite rapidly as well. And touching on the sustainability point that Katie raised, governments are sort of thinking around what's the long-term funding sustainability of universal healthcare systems. And, with the pressures from aging populations, more complex care, growing numbers of people needing to access care. So obviously technology has a huge role to play in that. We know remote consulting is around a third cheaper to deliver. There's kind of efficiency and productivity gains around how you can support clinicians to do shorter and quicker consultations. And obviously the opportunity of helping patients without even the need to see a clinician. So from a sustainability point of view, I think governments are considering looking at how we kind of embed some of the gains that we've seen in digital healthcare throughout the pandemic.
UK and the NHS has historically had a fairly poor record in terms of adoption of technology and digital. I mean, we only really need to look at the test and trace system that was looking to go through in the pandemic. I mean, do you think that we have the infrastructure in place to overcome this? And what do you see as major barriers to change?
I think we definitely do lag in many areas, some of particularly our European counterparts. So, the company I work for is a Swedish company. And so looking before the pandemic, there was already about 25% of remote consultation or consultations were happening digitally versus, or via video specifically, versus in the NHS was 0.5%. So obviously things have changed because of the pandemic, but in terms of the trajectory of digital adoption, it sort of shows where we're at in a European context. I guess it's probably unfair to say the NHS is a poor adopter at everything. I think what is true is that despite it being this kind of universal healthcare system, it's very localized and it's very fragmented. So you see these pockets of innovation of areas doing exciting things, but it's actually not a kind of consistent picture. And what that then doesn't enable you to do is to operate at scale. And one of the big advantages of using technology is the ability to reach scale and to reach bigger geographies and people. But in the NHS, there's a huge structural barrier there because it is very localized and very fragmented. So, GPs, community providers, even trusts, there's a limit in what they can do as standalone organizations. And obviously the creation of ICSs will be helpful in reaching more of a level of scale. But I think there are emerging structures. There's going to be some time before we get to that space. And there's a lot of other things to tackle along the way. So how much integration will happen over the few years is probably debatable. But yeah.
Great, thank you. And we've had a question come in from the audience, and it's around collaboration. Katie, if I can maybe put this to you. The race to develop a COVID vaccine has seen unprecedented levels of collaboration between academia, industry, and government. What do you think will be the relationships for this? Sorry, let me start again. Do you think it will continue, or relationships fall back to similar to what they were pre-pandemic?
That's a really interesting question. I think we shouldn't assume that the collaboration was non-existent pre-pandemic. I think it was simply that it wasn't seen or understood particularly well, and it hadn't quite happened at the same pace and scale that the pandemic has kind of brought to the fore. So I think collaboration was always there. The model of discovery and innovation has long been through partnerships spanning the globe, academia, industry, governments coming together to discover, trial, commercialize new innovations. So I think that's long been the structure. We've moved away from really individual companies having a huge R&D or manufacturing footprint in and of themselves. They are always working with labs, partners around the world, because that's just, that kind of collective approach, kind of hub approach to innovation, I think has long been the case. The pandemic simply accelerated that collaboration and demonstrated what was possible at a considerable scale and in a short time frame, which I think is really compelling. Will that remain? I imagine we will fall back to pre-pandemic, but maybe that's the cynic in me. But I think likely we'll move back to pre-pandemic. What I would say is, where I would argue we probably need greater collaboration, to Declan's point, is at the local level between, and I think the vaccine rollout is an exceptional example of what's possible when you have local council, primary, secondary collaboration really happening, and there's that agility and collaboration and communication happening to deliver a large-scale public health program. That's the kind of collaboration I think we probably need to see much more of to deliver integration, population health planning. That's why I would love to see greater collaboration. But look, I think collaboration between the life sciences sector, the innovation sector, governments and academia has long been there. More of it is a good thing. The more people understand that that's the model, is a good thing. And that it's truly global as well, that it's very unusual, I think, to have it isolated into one geography. Really, this innovation now spans multiple markets, multiple geographies, which again, I think is a good thing. The more people can know and understand that, because it has an impact on how those products, the end innovation is then brought to the patient or to the consumer, and at what price point. And that's also, you know, an interesting dynamic that I think is good for more people to understand. But as I say, collaboration locally and in delivery and in population health planning, I think is where I'd love to see even more integration and collaboration.
Great, thank you. Joe, given your experience with the UK Vaccines Task Force and now obviously with Seqirus, I mean, where would you like to see more collaboration, and where do you think it would deliver the biggest impact?
Well, I think probably it's the born optimist in me, but I'm a bit more optimistic than Katie. I think on this, there's no doubt that, you know, the collaboration that happened during the pandemic between the scientific community, industry, and government was extraordinary. And you mentioned our work, I mean, on the Vaccines Task Force, that was a product of that. That was bringing in specialist expertise to work in a government department to help tackle, you know, significant health threats. And I had the privilege of seeing that firsthand. And that collaboration enabled us to develop, make, and roll out a COVID-19 vaccine within 9 months of the pandemic being declared, which in anyone's book is extraordinary. And it was entirely achieved through collaboration. And I'd like to think that that is a blueprint for future pandemics, if nothing else. I mean, now that we've seen the impact of a pandemic, and we know there will be future ones, I think it will be impossible for governments not to consider enhanced pandemic preparedness strategies, and collaboration has to be part of that. At Seqirus, we've worked in pandemic preparedness, not me personally, but the company, over 100 years. And until COVID, it was something of a hard sell because it was quite an abstract concept. It was like, you know, why would you buy household insurance if you didn't have to, for example? And I just hope that governments don't have short memories. So although we'll be out of the pandemic, I think the impact of it hopefully will live long in the memory, and enough to make sure that we continue to you know, share the importance of collaboration and work with the scientific community and industry partners to share expertise and plan for the future. Any future health threat, whether that's an epidemic or a pandemic, will need things like potential testing, upscaling of testing capacity. We need R&D facilities. The government are looking at onshoring manufacturing capability for vaccine manufacture. And we need vaccine and treatment deployment facilities and staff. So that speaks to more collaboration, not less. And I just hope that we can learn from what we're coming out of.
Okay. I can just sort of add a quick point in terms of where it'd be great to see more collaboration, particularly with patients in the patient community, is around the use of patient data. And you know, we saw like a big pushback around the general practice data extraction, and that was a failure of communication to take patients with us and collaborate with patient groups and sort of demonstrate to them the benefits of kind of using data in a more insightful way. And so, yeah, sometimes we kind of think very organizationally and internally around the structures of the healthcare system without actually thinking about the wider patient communication piece and how we can collaborate with those groups as well.
Definitely. So Declan, how do you take the patients with you? How do you shift their mindset from something that is, you know, defensive minded or worried about private companies having access to this information, and being able to turn into something a lot more productive and being able to show the positives that this can deliver?
I think it's really, and I'm sure Joe's experience on the task force would demonstrate this as well, around where you demonstrate clear benefits to the patients and the wider society and the community around why you're using that patient data. The fantastic use of data in the vaccine rollout campaign in terms of identifying groups who may be more culturally resistant to vaccine uptake, etc. So demonstrating the clear benefits, giving people the confidence that you're using data in a secure way, and particularly when you're collaborating with third-party organizations. So yeah, I think the tendency is to sort of default to not communicating for fear of the risks and people becoming defensive, but you need to be quite front-footed about it and make the case of why better use of data is better for everybody, and it allows us to innovate and bring more medicines, etc., to the NHS.
Great. And obviously you mentioned NHS just there as well. So I wanted to get your thoughts actually on Amanda Pritchard, who's come in to replace Simon Stevens. I mean, what do you think her presence will be like? Is this a continuity piece, and how will it affect healthcare transformation in England?
I mean, I think she's definitely the sort of continuity choice. She's had her hands all over the creation of ICSs, so she's helped set the direction of travel that we're on in terms of integration. Also, when the kind of immediate number one in her priority list is dealing with the kind of pandemic recovery and moving from chief operating officer, where she has a deep understanding of the kind of mechanisms and internal structures of the NHS, is obviously incredibly helpful. I think it's kind of part of a wider shift, though, that was happening towards the end of Simon Stevens' tenure, where the government were really trying to take more direct control over the NHS. And we know that, in the run-up to the next general election, the NHS is likely to be, if not one of the most important issues. So I think the government can see that their political fortunes lie in terms of the NHS's ability to tackle these big challenges that we face coming out of the pandemic. And so therefore they want to have more direct oversight and control. And Amanda Pritchard's style of leadership is more of a kind of operational focused, collegiate style of leadership, which is arguably what the system needs at the moment. But I think you're going to see less of what we saw with Simon Stevens, which is an iron grip over the NHS, but also very publicly going on Andrew Marr and kind of negotiating with the government and being a political figure in his own right. I think the government now are taking back that control and narrative over the NHS.
Right. In fact, Katie, I think in our preparation calls, we were actually talking around the sort of politicization of health and whether it was a good thing or not. What does this necessarily mean, and how can the Department of Health work this into their advantage?
Yeah, I think it's one of the most interesting, certainly for me, one of the most interesting kind of trends and shifts we've seen in the last, I think it was happening before the pandemic. Through some of the work we've been doing, we've been seeing, and actually at the demand of patients, often advocacy coalitions demanding greater political scrutiny over decisions that were being taken, particularly around access to new treatments and therapies and innovations, where they felt there were bureaucratic blocks on their ability to be part of a transparent process. Not always, but that was often the accusation. And I think the pandemic highlighted for government, for the department, that they were too far removed from some of the critical decision making. They didn't have the power to make those decisions quickly at a time of crisis. And also there's a push and pull here, because there were at the same time sort of a huge democratization of the healthcare conversation, because suddenly every single person was touched by this in a way that meant they were compelled to be, they wanted to know what the system was doing, how they would be cared for, how they would be protected, how their loved ones would be looked after. And suddenly there was a very compelling reason for government, because the electorate in its entirety were being touched by this. So you can see the kind of a perfect alignment of forces requiring government to take greater control and oversight over healthcare decision making. And so the Health and Social Care Bill affords far greater powers to the Secretary of State to intervene, to afford powers to agencies and arm's length bodies to remove them, to create them, to shut them down. So that's, I think, very, very interesting. And health has always been a very political sector and political topic for all obvious reasons. But I think, just as I mentioned before, the social care funding announcement, that is all part of a programme from Number 10 readying itself and putting itself onto an election footing. And it kicks things off with a major financial commitment to social care, swiftly followed by a reshuffle. So you can see that health, as Declan rightly says, I completely agree, will be front and centre of this government's, readying itself for an election in 2023 likely. So that's, I think, been a trend that had commenced before the pandemic, rapidly accelerated. Legislation is in train to kind of solidify that, and I think we will see far greater political involvement and scrutiny back into health that was initially removed with the Lansley reforms back in 2012. That's now back in play, for good or for bad. That is now, I think, firmly back in play.
And on that note, I mean, we're talking here a lot about sort of politics, policy. I suppose the third P in all this is patients. So where do you feel that patients, and particularly patient advocacy groups as their sort of representatives, fit in this, and how can they influence policy making?
So I think, I mean, from my perspective, as I mentioned, I think the pandemic has been a health education exercise for each and every one of us, whether you work in the sector or work in the NHS. I mean, health touches all of us, but I think this has been particularly sort of a levelling experience. And so what I think for patient advocacy groups, that means there's been, the pandemic has shown the economic impact of health and poor health on society, on the economy, on the United Kingdom. And so when you're campaigning and articulating the cost of a condition, that's now acutely understood, and how that can be felt very keenly by families and households. That actually the pandemic has shown that it can sometimes cost more to care and treat someone who is unwell than it is to prevent. As Joe's mentioned, all of those, the social distancing, mask wearing, etc., had a huge impact on flu. And so that's been a really interesting kind of, again, an education exercise for people to understand when money is perhaps well spent, and prevention being back on the agenda and being part of an advocacy group's kind of campaigning platform and position. How disease impacts particular demographics and particular groups of patients more than others. Again, the pandemic has shown us that very acutely. But I think very practically for patient groups and organisations, that, as I mentioned, that politicisation means they have a whole new group of stakeholders who are once again compelled and to engage in their ask, in their campaign, in their movement, in what they need, where previously those groups might not have been so receptive or interested in their arguments. I think you have, Whitehall and Westminster has been opened up again to patient advocacy, which is, I think, a good thing. So that would be, I think it would be very interesting to know and understand the extent to which patient advocacy groups have really suffered, because of course, totally unable to raise money, totally unable to advance perhaps their position when the entire news agenda, not just the health news agenda, has been dominated by COVID. So, the ability to advance your cause, raise for your cause, has been severely hampered. But I would hope, now we're on the other side, there are some real wins for the advocacy community, as I say, in greater access to political stakeholders, and greater knowledge in the public about how disease and ill health can directly impact society and the economy.
Definitely, thank you. And Joe, maybe I can ask you more about your experience of both in terms of Securus, but also what you're doing with the UK Vaccines Task Force. How did you engage patients and patient groups, considering that this obviously wasn't a recognised group for this? How did you manage to speak to them, make sure that what you were doing was reflecting their concerns and interests?
We didn't work with them directly, I'd say, but mainly because we were on different priorities. A lot of work we did was around manufacturing. We did actually, through the work I talked about in recruiting people to the vaccines registry. So that was predominantly where we engaged them. But look, they are essential. When I talked about the messenger being important and understanding the message, what's really important to know how to communicate is to consult with the very people who are representing patients and understand what their needs and concerns are. And I think industry hasn't typically been great at consulting patient advocacy groups when doing communications campaigns, but really should. At Seqirus with flu, again, there's no sort of flu advocacy group, but there are elderly groups. So we work with Age UK and Carers UK, and then the sort of chronic disease patient groups that are affected by flu, like Asthma UK and the British Lung Foundation. And they are real experts in understanding, obviously, what most concerns patients. And they are very good at articulating what patients need. And as Katie says, it's great to hear that they're actually going, advocacy is back. But I also accept that, they've had a rough ride over the last 18 months, but they are essential at communicating exactly what patients need.
I love that. I think that's the statement for this, is advocacy is back. And on this, and I suppose it's linking back to one of our first questions, which is around kind of the priorities in terms of the backlog. How do you see that patients can help to sort of drive this agenda in terms of because obviously now we're going to see a race of many different priorities, from cancer to a lot of sort of deprioritized areas. So how do you think that patients can play a leading role in making sure that that their needs are recognized here? Declan, can I come to you first?
Yeah, I mean, speaking from a digital platform that is a kind of a digital front door or an interface for patients into the healthcare system, we're still not in a place where we have a full comprehensive idea of what the backlog is yet. We know how bad it could get, but we still don't really know where we're at. So there's still the process of kind of stratifying the risk of patients who have yet to filter through the system. And so giving patients, a route to actually come forward. We're seeing a huge bottleneck in primary care, which is the gateway into the system. And so if the front door is locked, how are patients actually going to express what they need in terms of their clinical needs, etc.? So I think sort of stepping back a minute and realizing that the elective waiting list is the sort of end destination for a lot of people, but we need to start thinking a lot more decisively and earlier about how we manage this pent-up demand across the entire system, because there is a real ripple effect in terms of people who miss cancer diagnoses and turning up in A&E, and there's all the demands in A&E, and so it's all interlinked, and we can't just look at it from a purely elective perspective.
Thank you. And Katie, I can come back to you on that one as well.
Yeah, I think it's sort of linked to conversations we've been having around collaboration and patient advocacy groups will find that you don't want to find yourself pitted against one another, competing to articulate why the groups you represent deserve to become front of the queue when looking at how resources are going to be allocated to manage this backlog. So I think it would again be about encouraging as much collaboration as possible, so that it can be kind of a united front in terms of how this is best managed. And I think engaging as best as possible with ICSs in terms of how to plan appropriately at scale to manage this, that it's not simply managed in pockets, but it is a system-wide response. But wherever possible, the advocacy community can come together because there's a shared objective. arguably irrespective of, the patients you represent.
Okay, and Joe, one of the things that obviously we've seen throughout this time around the vaccine is the sort of amplification of systemic and structural global health inequalities, particularly around access to vaccines and also to healthcare. We like to see more of a concerted effort from government to try and close this gap.
Well, I'd certainly like to think so. What the pandemic has done is put on kind of full display, if you like, the stark inequalities that do exist when it comes to accessing healthcare. We know there's huge variations in outcomes between different countries, but also within socioeconomic groups and ethnic groups. COVID impacted every country, and it required all governments and health authorities to cooperate and work together. And some were clearly better at it than others. If we're to limit kind of future development of variants, then we need to be able to give access to vaccines. As an example, in developing countries, it's essential. Virus anywhere is virus everywhere, as they say. Like if I give a flu example, say like COVID, flu is a globally connected virus. And what I know of the flu vaccine in a flu pandemic is that it's most effective when everybody has the opportunity to have one and they take that opportunity. Also in flu, what we have is public health authorities cooperating on looking out for strains that could potentially become a pandemic. Now that's in flu, but the same approach could be taken when managing any global virus that's transmitted. And there should also be greater access to flu vaccines, I think, in developing countries for that very reason. Governments will have to address this inequality. And so it's very, very welcome to see the UK government prioritising actually with the new Office for Health Improvement and Disparities. So there's lots of work to be done. The pandemic, if you can say it, has been useful, shining a spotlight on the inequalities, but now we really need to address them because it affects all of us.
Right.
Would you mind sorry, I just wanted to add that I completely agree with what Joe's just said there, and I think this new OHID body that's arguably tasked with looking at healthcare disparities is a really good indication of government's ambition. I think also ties very much into Boris Johnson's levelling up agenda, which arguably the pandemic again has really highlighted where there is social deprivation, poor access to healthcare services, isolation, and so on, that your ability to kind of stay well and out of hospital is severely hindered. And so I think, again, when thinking about with a sort of political hat on and run up to an election, I think you can see healthcare and the levelling up agenda starting to become as one, and it being a very good example of where the sort of Johnson administration wants to get to with this so-called levelling up agenda, which of course, as Declan will know, is the introduction of digital services is a brilliant means of addressing that.
Yeah, no, I 100% agree with Katie there. I think in terms of whatever levelling up is yet to be defined as, like, tackling health inequalities is the most clearest and meaningful way that they could start to address that. And yeah, looking at the international context in terms of using technology, I think if you look at what happened in other sectors, like in fintech in developing countries, where you have a high uptake of people with mobile phones, and they've almost leapfrogged the need for a traditional banking system because everybody has access to digital services. So you see lots of penetration of mobile payments, online banking, etc. I think, similarly in healthcare, we now have that huge opportunity to reach many more people in a way that we wouldn't do. But that includes in the UK. So, we're fortunate that, we have 89% of people in the UK have a smartphone. And lots of the people are often marginalized and cut out of the healthcare system for a variety of reasons. So there is a way of actually improving access for those people. And to give some examples, in our app, people can have a consultation in 16 different languages. So people who don't have English as their first language or have British Sign Language interpreters, So a lot easier for people to access the system in a way that would be harder through a traditional general practice. So yeah, technology should be a great leveler, which is what Sajid Javid set out last week at London Tech Week. It's just getting the system to move quickly in that direction.
Great, thank you. And we've just had another question from the audience here around what are you most excited about the future of pharma innovation? I suppose if I can come to Katie first for this one.
Wow, that's a really good question. Because it's fresh in my mind, I'm particularly excited about a conversation I had this morning about stem cell technology. And that's part of the COVID conversation as well. I've done a huge amount of work in the recent years in cell and gene therapies. I mean, the possibilities of some of these cell platforms are remarkable and endless. And so I think there's a huge amount of possibility. I think it raises a policy as a regulatory challenge around multi-indication pricing and how do you bring these sort of platform technologies to market effectively. But nonetheless, irrespective of those potential challenges, I think they are hugely exciting. Yeah, the future of healthcare.
Excellent, thank you very much. And Joe, what about yourself? Do you have any sort of areas that you were particularly excited by?
Excited by also, it's top of my mind, obviously, is in vaccines. And what has happened during the pandemic is you've seen all the new technologies that have come in for COVID vaccines. So the messenger RNA vaccines, my own company is got an accelerated development program for self-amplifying messenger RNA vaccines, which is kind of a next generation mRNA. But also innovation in terms of manufacturing, speeding up manufacturing. We also saw regulatory innovation with the MHRA working alongside manufacturing and expediting a regulatory timeline. So you got record approval for vaccines when you needed them. And also things like we worked on the Vaccines Task Force with an organization called CPI, who have a library that they're developing of variants and strains of COVID, but that could equally relate to any viruses. So I think the saying in comms we always have is never waste a good crisis. Well, there's been a huge amount of innovation that's had to occur because of the situation we were faced with. But, we can build on all that. So it opens up massive possibility for the future, because mRNA doesn't just work in COVID, it can work in cancer, it can work in all sorts of diseases. So it is very exciting in vaccinology.
Just to add one more, there's a sort of slight crossover from pharma into our space, which is probably less at the kind of cutting edge scientific spectrum, but kind of widespread use of remote monitoring tools through the pandemic kind of opens up this possibility of more real world evidence and reaching harder to target patient groups that have been missing and unlocking some of those things like multi-indication pricing previously. So having more of that kind of knowledge of what's happening to patients in the community obviously is a huge potential.
Great, thank you, Dick. I was actually just going to come and adapt that for you. So thank you for jumping in. I mean, I suppose what we've heard quite a lot here in terms of policy themes are things like sustainability, which is a very large sort of international and global reaching theme. The idea of resilience as well, thinking how we can do this. And also, Declan, you talked earlier on about managing things at scale. Now, all these you can look at actually working with international partners like we have in the pandemic. How do you feel that something like Brexit is affecting our chances of being able to prepare and deploy against these challenges? Katie, could I come to you?
Of course, yeah. I mean, I think it's quite difficult to extrapolate at this moment in time. Where do we sort of lay the blame at the foot of the pandemic or at the foot of Brexit? I think there are lots of factors at play. I think on the one hand, we've seen already government and bodies, including the MHRA, step up to the promise of Brexit as opening the door for us to design regulatory pathways precisely as we wish to accelerate adoption and accelerate access. So that ILAP, Innovative Licensing and Adoption Pathway, which was launched earlier this year, is a really good example of doing what we said we would do. And I think some 20 odd products have already worked their way through that. I mean, that's really impressive. So we're already seeing a kind of regulatory innovation that Joe was mentioning is happening. I think global standing, our ability to attract innovation and adopt in a global innovation here, I think remains to be seen. I think the life sciences vision is obviously a really important step for government to address some of that and try and remain competitive and attractive as a country that sponsors innovation and celebrates innovation. I think we can't escape the fact that the UK is no longer where it was once perhaps a launch market. I don't think we can say that's true anymore. And when we have conversations with clients, it's likely we're engaging in sort of wave 2, 3, or 4 when it comes to engaging UK, and we're launching elsewhere first. And that's just the reality. But again, is that Brexit? Is it indeed just sort of the long tail of years of kind of challenging access disputes, some of which in more recent times have been very, very public and very, very difficult and quite political? I don't think Brexit has necessarily helped. So I'd say there are, as ever, to sit on the fence, pros and cons. But I do firmly believe it still remains to be seen exactly whether this is some supply chain challenges, for example, are entirely down to Brexit or have been compelled have been made much worse by the pandemic.
Great. And, you know, I think that we could probably build on to that and around sort of the impact of NICE and its own sort of pricing suggestions. But I mean, I think that's something we could probably spend a bit more time on in a different session. But in generally, we've talked quite a lot about the major policy themes being around sustainability and very much around building resilience. Is there anything else that you think that we should maybe be looking at over the next 5 years, Joe?
Yeah, it's hard enough predicting policy at the best of times. It seems particularly tough at the moment. But you mentioned resilience. I'd add pandemic preparedness to that. It's obviously going to be the top of, you know, government agendas across the world without question. Pandemics actually were already the top spot on national risk registers in most countries anyway. And flu is most likely to be the next pandemic. It was responsible for the last 4 pandemics in the last 100 years. And I've talked about the fact that, you know, deaths from flu in any year can range from 10 to 30,000, which roughly equates to 65 to 200 deaths per day, which is kind of the same level as COVID. So in future with pandemics, it won't be possible for health systems to shut down and for resources and staff to be repurposed to manage them. So what governments will need to do, and the UK government are actually looking at this, is to be able to scale up quickly and deploy vaccines at a faster pace to manage them. So for me, you know, we're probably all tired of talking about COVID, but it has to be a central policy for the future because we know it's going to happen again. So governments have to look at it and they have to have those policies in place.
Great, thank you. And Declan, in your mind, where do you think essentially the policy landscape needs to move in the next 5 years?
Yeah, I think, you know, speaking through obviously a lens as a technology provider, is that we've kind of seen this huge, rapid, you know, arguably move 5 to 10 years quicker on the journey of digital transformation than because of the pandemic. And it gives us a huge opportunity. We're sort of almost at a crossroads about what we do next in terms of digital adoption in the NHS. And yeah, there's some risks involved in moving at that much pace and at that much scale quite quickly. But yeah, how we kind of embed some of those gains that we've seen And, arguably the remote consultation bit is this sort of foundational layer that's the sort of the building block, but it's only one part of the journey. Then you start thinking about what ICSs are trying to aspire to do in terms of population health management. That requires more technology to capture data, to turn that into meaningful insights so that you can then plan and deploy services at population level. So I think we're still very much at the beginning of that digital journey, and how we make the most of the opportunity the pandemic has given us is crucial.
Great, thank you very much. I don't think we've had any other further questions come through from the audience, but if there is any more, please do obviously send them through in the chat. If not, I think that's pretty much all we have time for in this session. So I just want to say thank you very much to all of you today for a really fascinating session and providing such great insights. And also thank you very much to our sponsors, Vulio, who, for their ongoing support and who have been helping to make this event possible. And then finally, thank you all for everyone who's joined in and got involved today. It's been great to have you all with us. The session has been recorded and will be available via the PRCA channels very shortly. So all that's left to say is thank you very much for joining us, and we shall see you all soon.
Thank you.
Thank you.
Thanks,
Thanks,
Matt.
everyone.
Thank you, everyone.